the recruiter and I will be interviewing you.
Hi, nice to meet you.
Let's get started, please. Can you tell me a little about yourself and how you realized you wanted to be a healthcare provider?
Since I can remember, I have observed various situations in which the people who were part of my environment didn't receive adequate medical attention, and I have wanted to find a way to change that situation.
Okay. Um, why did you choose to become a doctor?
I choose to be a doctor because I really enjoy understand how the body works. I have always considered it to be perfect and very machine in the same time. It's simple great to understand some of the multiple processes that occur in our organisms. I have always wanted to contribute something to science, and I consider that being a doctor you have the opportunity to impact not only in the life of the patient but also in the whole society around us.
Why have you chosen this field of specialty?
Plastic surgery for many people can be a vain or even superficial specialty, but I think they are wrong. Plastic and reconstructive surgery give us the power to improve physical aspects, seeking to improve confidence in patients without fearing stereotypes.
Excellent. What is your professional experience as a doctor?
I worked in a private practice for 2 years attending patients with a common condition. Later, I entered the specialty in general surgery, where I was transferred to plastic and reconstructive after 2 years. During my academic training, I was able to participate in a several surgery of high complexity. After finishing my specialty, I had the opportunity to perform a rotation in a foreign hospital dedicated to plastic and reconstructive surgery. I worked for 2 years in the same hospital where I'm studying my specialty. There I was fortunate to meet several excellent doctors, and with them I have been able to found a plastic and reconstructive surgery clinic.
Okay. What attracts you this job opportunity?
This job opportunity caught my attention for the first time I read about it. This hospital has a great doctor caring for a large number of patients every day, has a great surgical team and the right technology for less invasive procedure. The idea in plastic surgery. I convinced that this job will make me perfect my skill as a specialty and will make me grow as a professional.
And what would you consider to be your main strength?
Well, I consider assertive communication and teamwork. This together interference with adequate and objective decision making where the point of view of all experts involved in this case is taking it count.
Tell me about your experience with patients who require your time. How did you take care of these patients and still provide your other patients with adequate care?
I once had with a very demanding patient in his condition seemed to require all time and knowledge. I first identified if there were conditions that would complicate or threaten the life of the patient in the hospital unit and prioritize them. In this case, my patient has allergic to some medication that will be used in the procedure, and she mentioned bleeding the day before surgery. So I ordered a blood test and make sure her bleeding signs at loading times were correct. Their eyes were normal. After that resume, patient approached me.
What are your short term aims, professional speaking?
I would like to take experience for this job, make a great community with my patients, and I have great management to my career.
Imagine you have to communicate bad news to a patient concerning their health. How would you manage the situation?
First, I will gather all the clinical information to make sure I'm ready to answer your question. If there is a relative or responsible person in the room, I will introduce myself to everyone and check it if the patient prefers to receive the results in private or in their company you can stay. I will start by saying I'm sorry, but I have some bad news. I will explain the situation frankly and without complicated words to make sure everyone understands. I know it's important to allow the patient to process the information, so I will wait before repeating the key data and writing it down for the patient. I will explain to them what they can expect shortly and make sure there are no more questions before I leave the room.
What are the areas do you need to improve upon?
I consider there one thing I need to improve is to be able to let go of leading a little of the work. The things to do will always increase and possibly never finish to the things you have to do. But time goes by, you can stop doing these things you enjoy because of work. Another aspect to improve is to stop looking the perfection in my life, as it is quite tiring and prevent me from enjoy the good things I have.
What is your ability to face the challenge, both medical and personal?
I consider that I have the ability to be able to find a solution to every challenge that comes my way. I prefer to see challenge as opportunity to grow and not as obstacles. In every challenge in my life, I set a goal and I thinking, how will I get it? How will I proud to obtain it? In some way, thinking like this helps me to able to overcome and enjoy the process.
Why do you think you would be a good match for this position?
I thought I'm meticulous and I look like working in my own. Also, as a doctor, I'm used to criticisms and I think it very well. My first professional experience in relations have been very successful.
What are your personal interests outside of medicine?
My personal interests are diverse and enjoy music very much. I have to believe that in other life I was a great singer, obviously in another life. In this one I have to be satisfied just saving life. I'm also passionate about sports. Professional, I practice any, but I watch sport competition whenever I have the opportunity.
Well, we are done with the interview, doctor. We will call you soon with good news.